Hello and welcome. Today we're diving into a rare and complex condition affecting hearing, called auditory nerve aplasia. This video will explore what auditory nerve aplasia is, its potential causes, how it affects the body, and the current approaches to diagnosis and management. While we often think of hearing loss stemming from issues within the ear itself, auditory nerve aplasia presents a different challenge, one rooted in the very pathway that carries sound information to the brain. So, what exactly causes auditory nerve aplasia? In most cases, it's believed to be the result of genetic mutations that occur during fetal development. These mutations disrupt the normal formation of the auditory nerve, the crucial link between the inner ear and the brain. While specific genes haven't always been identified, research points towards a complex interplay of genetic factors. Less frequently, environmental factors during pregnancy, such as certain infections or exposure to teratogens, might play a role. Though these are far less common and harder to definitively link to the condition, it's important to remember that, for many families, the exact cause remains unknown. Let's delve into the pathophysiology, or how auditory nerve aplasia actually impacts hearing. In a typical hearing process, sound vibrations are converted into electrical signals by the hair cells within the inner ear's cochlea. These signals then travel along the auditory nerve to the brain, where they are interpreted as sound. However, in auditory nerve aplasia, the auditory nerve is either completely absent or severely underdeveloped. This means that even though the inner ear might be functioning correctly, the electrical signals cannot effectively reach the brain. Consequently, the brain receives little to no auditory input, leading to profound hearing loss. Due to its rarity, the exact epidemiology of auditory nerve aplasia is not well defined. It's considered a very uncommon cause of congenital hearing loss, meaning hearing loss present at birth, because diagnosis can be challenging and sometimes confused with other types of auditory neuropathy. Precise prevalence rates are difficult to establish. Studies suggest that it accounts for a very small percentage of all cases of profound congenital hearing loss. Ongoing research and improved diagnostic techniques are gradually refining our understanding of how frequently this condition occurs. The primary and most noticeable symptom of auditory nerve aplasia is profound hearing loss, typically detected shortly after birth during newborn hearing screenings. Infants with this condition often show no response to sounds, even at loud volumes. They may not startle at sudden noises or develop typical speech and language milestones. Other symptoms, though less directly related, might include difficulties with balance and coordination in some cases, though this is less common than the hearing loss itself. Early identification of these symptoms is crucial for initiating timely intervention. Diagnosing auditory nerve aplasia requires a comprehensive audiological evaluation. This often includes otoacoustic emissions (OA) testing, which assesses the function of the inner ear's hair cells. In cases of auditory nerve aplasia, OAs may be present, indicating that the inner ear is working. However, auditory brainstem response (ABR) testing, which measures the electrical activity of the auditory nerve and brainstem in response to sound, will typically show absent or severely abnormal responses. High-resolution MRI imaging of the brain and inner ear is also crucial to visualize the auditory nerve and confirm its absence or underdevelopment. A definitive diagnosis relies on the combination of these audiological and radiological findings. While auditory nerve aplasia doesn't have distinct types or classifications in the traditional sense, the severity of the nerve's underdevelopment can vary. In some instances, the nerve may be completely absent aplasia, while in others, it may be severely hypoplastic, meaning underdeveloped but still present to some degree. This difference in the degree of nerve development can influence the potential for some limited auditory function, though even in cases of hypoplasia, significant hearing loss is typically present. Currently, there is no cure for auditory nerve aplasia. Management focuses on providing alternative pathways for communication and maximizing the individual's potential for development. Hearing aids are generally ineffective because the auditory nerve itself is the problem. Cochlear implants, which directly stimulate the auditory nerve, are also typically not beneficial in cases of complete aplasia. The primary treatment approaches include sign language training, visual communication strategies, and early intervention programs designed to support language development and social, emotional growth. In some cases, auditory brainstem implants may be considered, but these are complex procedures with variable outcomes and are not suitable for all individuals. The decision regarding ABI candidacy requires careful evaluation and consideration of the potential risks and benefits. Because auditory nerve aplasia is primarily caused by genetic factors, there's currently no known way to prevent it directly. Genetic counseling may be beneficial for families with a history of hearing loss or other related conditions. This can help them understand the risks of recurrence and explore available options, such as preimplantation genetic diagnosis of PGD during in vitro fertilization. Although PGD is not specifically designed for auditory nerve aplasia and may not always be applicable, the prognosis for individuals with auditory nerve aplasia depends heavily on the degree of hearing loss and the effectiveness of early intervention strategies. With consistent and comprehensive support, children with this condition can learn to communicate effectively using sign language and other visual cues. While spoken language development may be limited, individuals can achieve significant levels of independence and participate fully in society. Research into alternative therapeutic approaches, such as gene therapy or advanced neural prosthetics, is ongoing, but these are still in early stages. Continued research offers hope for improved treatment options in the future.